I will discuss some common gastrointestinal symptoms a patient may present with when their chief complaint is abdominal pain. This list is not comprehensive, but includes common ones that will help you focus in on specific history questions. Just a quick reminder about our old CARTS acronym used for asking the history of present illness. It is used during the subjective portion of the exam. I will be using S to mean symptoms to describe the associated symptoms. The gastrointestinal system, also known as the digestive system or alimentary canal, is an organ system that is responsible for the transportation, digestion, and absorption of food and nutrients. It contains hollow viscous organs, including the mouth, esophagus, stomach, small intestine, large intestine, and solid organs, including the liver, gallbladder, and pancreas. I have found it useful to identify the cause of abdominal symptoms by remembering the anatomical origin of the intestines. The GI tract is divided into three broad anatomical regions that are formed during embryonic development: the foregut, midgut, and the hindgut. The foregut spans from the mouth to the second portion of the duodenum, part of the small intestine. The midgut spans from the distal aspect of the second portion of the duodenum to the proximal 2/3 of the transverse colon. The hindgut spans from the distal 1/3 of the transverse colon to the proximal 2/3 of the anus. Symptoms that may be considered foregut symptoms include vomiting, reflux associated with heartburn, dysphagia, difficulty in swallowing, hematemesis, which is the vomiting of blood, usually from a source in the upper GI tract. It's important to note that this is not to be confused with hemoptysis, which is the coughing up of blood associated with the source in the respiratory tract. Early satiety is where you feel full quickly, even after only a small amount of food. Belching, and syngultus, also known as hiccuping. It is a sound made by rapid closure of the glottis due to a reflex spasm of the diaphragm, often a symptom of indigestion. Symptoms that may be considered midgut symptoms include anorexia, loss of appetite, or flatulence. Symptoms that may be considered hindgut symptoms include diarrhea, constipation, commonly defined as fewer than 3 bowel movements per week, obstipation, the inability to pass stool or gas, melena, the passage of dark tarry stools, commonly comes from an upper GI source. But it is important to mention here that it can be due to GI bleeding anywhere in the GI tract. The passage of bright red blood per rectum, or hematochezia, is similar to melena in that it can come from anywhere in the GI tract, often a lower source. As a note, the most common cause of a lower GI bleed is from an upper GI source. The other common gastrointestinal symptoms that don't easily fall into a category are fever, malaise, a lack of well-being and overall feeling of discomfort, nausea, weight loss or gain that is often not intentional, icterus or jaundice, which is yellowing of the skin or sclera. This is referred to as scleral icterus. Edema and bloating may also be associated with pain. It is also extremely helpful to ask about associated symptoms and when they occur. Do they occur before, after, or during the pain? There are several other symptoms the patient may complain of when they experience abdominal pain. Oftentimes, these can coexist with the chief complaint of abdominal pain. These other symptoms can be within the urological and gynecological systems. These will not be extensively covered in this lesson.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how MedMastery can help you become a great clinician, make sure to watch the About MedMastery video. So thanks for watching, and I hope